Thank you for joining me today. I want to go over with you for medication and case studies. And the medication that I have here for you is called Amisulpride, and it is second generation atypical antipsychotic medication. It used to treat schizophrenia for both positive and negative symptoms. And I will go over patient background and presenting symptoms, clinical finding, clinical assessment and findings, rationale choosing this medication and treatment, dosage, safety consideration, monitoring plan, and treatment outcomes. Amisulpride is the medication. Amisulpride is typical antipsychotic medication, as we talked about, and it is substitute benzapride. It uses primarily in Europe and FDA not approved in US. So it's not approved in US, but they use this medication in Europe. The first case study that I have for you here is the 23 years old who have first episode of psychosis. This patient is presenting with hallucination, delusion, and social withdrawal. Visible history is hydrophil 6 months ago. So the first symptom came 6 months ago, and the patient has withdrawal symptoms and decline social interaction. Amisulpride is chosen because it has a strong dopamine D3 and D2 action and benefit for both positive and negative psychosis. The dosage that we want to begin is 40 milligram a day. You will have to monitor EPS symptoms at the higher dose, and also prolactin elevation, QT prolongation also, and palpitation, seizure, cardiac arrhythmia. You will have to also monitor the EKG, electrolytes, EBA symptoms like abnormal movement, stiffness, seizure. That's what you want to monitor for this patient who came with the first episode of psychosis, hallucination, delusion, paranoia, and social withdrawal. The outcome that you are expecting are reduce the hallucination, improve the effect, and prolactin monitoring. You will be monitoring the prolactin. second case study that I have for you. Before I go to the second case study, I want to go over the EBA symptoms. And those EBA symptoms include akinesia, intense internal restlessness, inability to stand steady. So the patient will be shaking and moving and pacing. Also acute dystonia, sudden pain, muscle spasm, often causes twitch, neck twitching, jaw tightening, eye rolling. That is some of the EBS symptoms. Extraparamidary symptoms. It also has pseudo-Parkinson symptoms, mimic like a Parkinson disease, include tremors, include slow movement like bradykinesia, muscle richness, stiffness, shuffling gait. EBS also has TD, which is tachydyskinesia, which is involuntary movement, rapid movement, but particularly of the face, such as tongue protrusion, lip smacking, chewing, rapid blinking. So you will monitor those from the patient who is taking psychiatric medications. Other symptoms include droopy face, slurred speech, masked face, masked facial expression, and rigid lips. So the second case study that I have here for you is predominantly negative symptoms. I have a 33 years old who has a severe apathy, sadness, withdrawal without mark of hallucination. Assessment findings is a flat affect and slow speech. And then you will choose Amisulpride, low dose of 100 milligram a day, chosen for the negative symptoms. So it helps the both negative symptoms and positive symptoms of psychosis, and it's safe for sedation and hyper. Safety considerations are the sedation and hyperprolactinemia. You will monitor weight gain, prolactin, EBS symptoms. You will screen that. And then outcome that you wanted to gain from giving this medication is increased motivation and engagement within 3 weeks. It improves motivation and engagement. So it lowers the withdrawal symptoms. It lowers the sadness, it improves the sadness or improve the mood. It will treat the hallucination, apathy. So it will improve the patient function. Amisulpride pharmacokinetics include acting as a dopamine stabilizer. It has a minimal serotonin receptor activity. It is selective for limbic and straight dopamine pathway. It has a selective for limbic and straight dopamine pathways. The third case study that I have for you here is acute psychosis relapse. So this patient has acute schizophrenia relapse. This is 42 years old with chronic psychosis and relapse, often stop the medication. So this patient have been having a schizophrenia and now is on acute phase of relapse. So the patient have been treated and had stabilized schizophrenia and have been taking the medication, but he stopped the medication now and is on acute psychosis of schizophrenia. Presenting symptoms include severe agitation and persecution delusion. So the persecutor delusion, that means he thinks somebody is after him, somebody want to kill him, he's scared. The dose that you want to start with is 8 milligrams a day in divided doses. Safety consideration is this medication can increase the QT prolongation, and you will be concerning or you will be monitoring EBS symptoms like abnormal movement. You will monitor EKG baseline weekly and vital signs, and you will use EBS scale. The outcome that you are looking for or you want to see from this treatment include the stabilization of the mood, because the patient is agitated and have a persecution delusion, is scared. So you wanted that to be stabilized, and then you will transition to 600 milligram dosage daily for maintenance. You don't want that symptoms to come back, so you will prescribe that. Amisulpride pharmacokinetics include it observed orally, and its bioavailability is 50%. It has a low protein binding. It metabolizes minimally liver metabolism, and it's excreted in the kidney. So this medication is metabolized in the liver and excreted in the liver. So if the patient has a liver damage or kidney failure, this function will not be going, and it will increase the toxicity of the patient to the patient. The fourth case study that I have for you here is 23 years old with psychosis and agitation. This patient arrived extremely agitated and disorganized. He has disorganized thought and thinking, and he's agitated, and he has a psychosis. So you selected this medication, Amisulpride, due to its lower metabolic risks compared to a typical psychosis, typical antipsychotic medications. It has a lower metabolic risks. That means it increased the less weight, because they say it has a lower. That means it increased the weight less, it increased the liver less. So that's why you choose this medication. But the safety consideration that you have to monitor include sedation, prolactin increase, and EBS symptoms, movement, jittery, shuffling gait, lip smacking. That is what you monitor. You also monitor the vital signs, monitor the agitation score, monitor prolactin levels, and the outcome that you are expecting to see from the patient is decrease the agitation, mild or less EBS, and less sedation. Amisulpride clinical usage is the schizophrenia, both positive and negative symptoms of schizophrenia. Dysrhythmia, effective at very low dosage. Effective at the very low dosage. Dysrhythmia, it will cause dysrhythmia. May improve cognitive and affective symptoms. So it improves cognition, it improves the mood, it lowers the positive and negative symptoms of schizophrenia. That is the clinical usage for Amisulpride, this medication. The 50 case study that I have for you here is 55 years old patient with obesity, pre-diabetic, and he has a psychosis with metabolic risk. So he has a psychosis, but he's also risky with metabolic diseases like hyperlipidemia and diabetic. You don't want him to gain weight, so you choose this medication due to lower metabolic impact. It will not increase your blood sugar, and you will not gain weight as much as the other antipsychotic medications. So you choose to prescribe this dose 300 milligrams a day. Safety consideration that you have to monitor include 300 milligrams a day, and you will monitor QT prolongation, prolactin increase. You will monitor EKG. You will also monitor fasting glucose and lipids. The treatment outcome is a positive symptom improvement and stable metabolic levels. So the patient didn't gain weight, didn't have high hypolipidemia or high lipid, they didn't develop diabetic, but also you control the positive symptoms of the schizophrenia and psychosis, which is good thing. That's what you were expecting. Amisulpride dosing strategy include low dosage, start low dosage for the negative symptoms, dysrhythmia. The low dosage will be between 50 to 300 milligram daily, and higher dose will be 400 to 800 milligram daily, and that is for the positive symptoms of schizophrenia. So higher dose is for the positive, lower dose is for the negative. Maximum dosage is the 1200 milligram a day. The 6th case study that I have here for you is the 38 years old who presented here with depressive symptoms with delusion. So the patient is in psychosis with depression. Amisulpride treat depression and psychosis at lower doses. Then so you will choose 50 milligram a day. Safety consideration that you consider when you are prescribing this medication are sedation and prolactin elevation. You monitor the mood scale, you monitor the depression, you monitor prolactin, you monitor EBS symptoms of movement, abnormal movement, mouth, shuffling gait. The outcome you are expecting to gain from this treatment include mood stabilization, normal prolactin level, improved delusion or decreased delusion, minimum or none for metabolic diseases, like the patient didn't develop diabetic, no weight gain, no increase hyperlipidemia. Amisulpride side effects include, as we mentioned before, it includes ABS, which is abnormal movement. It includes hyperprolactinemia, glucocorrhea, anemia. It includes also QT prolongation, which is also dose dependent. Weight gain, insomnia, agitation, those are the symptoms you want to teach the patient to look for, and you want to look for those symptoms. And if they happen, you will stop the medication and switch to different medication. The 7 case study that I have here for you is a 44 years old with poor response to multiple antipsychotic medications, and this person has resistant, so you trial with this medication. They already have a resistant psychosis, then you trial with this one. The dosage that you want to start is 800 milligrams a day, because the patient already is resistant to other treatment. That's why you want to start the higher dosage. Safety consideration that you have to monitor and be careful or watch is the significant EBS risk and prolonged QT or arrhythmia, because more you increase the dose, more symptoms you will get. You will monitor weekly EKG and EBS scoring, prolactin level. You will check also the prolactin level. The outcome you are looking for is improved mood, improved psychosis symptoms. Also, you want to have less symptoms. Those are what you are expecting. So as we mentioned before, you are going to monitor Amisulpride. You will monitor baseline, and periodically you will monitor the weight. You will monitor the blood glucose, blood lipids, blood pressure, because it lowers the blood pressure. You will check you will use EKG to check arrhythmia and QT prolongation interval monitoring. QT prolongation may lead to serious arrhythmia, heartbeat, heart palpitation, dizziness, and syncope. So that's what you want to manage. Also, you want to check the electrolytes like magnesium and potassium in the patient who are at risk. A specific population, you want to adjust the dose if the patient have renal impairment. You will adjust the dose and you will lower the dose, or you will switch medication that is better than this one. Elderly are sensitive to side effects. Elderly, they have impaired, not all of them, but the risk is higher for liver impairment, kidney impairment, heart issue, diabetic. So they have other comorbidity, so you will monitor those. Pregnant, you will avoid if possible and not recommended. If the patient is pregnant, you will not be prescribing Amisulpride. Okay. The 8th case study that I have for you here is psychosis in renal impairment. That's what we talked about. This is a 63 years old female with renal impairment and presented with hallucination. So she has a psychosis, but she has a renal impairment. What would you do? You will use this medication cautiously with dose reduced. You will prescribe 200 milligram daily. You low dose so that can not affect her kidney. And you will monitor still. If the kidney labs shows worsening, you will stop and switch to different medication. So you will monitor that. Safety consideration is drug accumulation. Because the patient cannot filter the medication, drug will accumulate the body, so there will be toxicity, and that means it will increase the symptoms because there is a medication that build up in the patient, and it will act like you given higher doses because it's not filtering to the kidney. So the patient will have a risk of EBS symptoms, QT prolongation, metabolic risks, heart, kidney, liver damage. So you will monitor the kidney labs, you will monitor heart from arrhythmia by using the EKG and vital signs. You will also monitor EBS symptoms, the outcome that you are expecting and you want to gain are control of the symptoms without toxicity. That's what you are looking for. You wanted to control the psychosis symptoms, but you don't want to have any other symptoms caused by this medication. So that is the outcome you are checking and looking for. The case study 9 that I have for you here is psychosis. Elderly patient with psychosis. This is 72 years old female with delusional and confusion. And she has a fall risk because she's delusional and confused. And she's fragile for fall and she can break. So, Amisulpride is chosen cautiously due to lower anticholinergic load. You choose this medication because sedation is less. The patient is already confused and delusional and has a psychosis. So if you add to sedation, there will be fall risk. Safety consideration that you want to watch for are low blood pressure, orthostatic hypotension. You want to monitor the QT prolongation, EBS symptoms of abnormal movement, abnormal balance, tongue smacking, drool face, Parkinson, pseudo-Parkinsonia symptoms. So you will monitor fall precautions. You will lower the bed, you will have a bell alarm, you will, if you are the provider, you will order those nurse to monitor those. Vital signs, you will check the EKGs. The outcome that you are looking for is improve the clarity, improve the cognition, mild sedation, and dissolve with dose timing. So the patient will have decreased delusion and confusion. It will improve the cognition, but it will not also cause any other symptoms from this medication. That's what you are hoping for. That's what you are monitoring. That's what you want to teach the patient and the nurses. Clinical case study 10 is psychosis with high agitation in a bipolar disorder. So this patient has a bipolar, agitation, and psychosis. He is a 36 years old male with bipolar disorder and presented with agitation. You choose Amisulpride because it has a rapid antipsychotic effect while stabilizing the mood. So it improves the mood and lowers the psychosis. You will choose 400 milligram daily, and the safety consideration, we already talked about those. The safety consideration is monitor and watch for and be careful about the EBS, prolonged QT, metabolic disorders. The outcome that you are looking for are reduced agitation within 48 hours of giving this medication, and then you will transition to combine other therapy. This will stabilize the mood, this will lower the agitation, and then you can add that to other psychotherapy and other medications that is useful for this patient. Take away from this video and lecture are Amisulpride is a unique antipsychotic medication, and it's dose dependent dopamine moderation. So it's effective both positive and negative psychosis symptoms. It requires carefully monitoring and dose adjustment. Effective for negative symptoms of schizophrenia. It has a minimal serotonin receptor activity that is unique to this medication. May combine with clozapine in the treatment resistant. So if the patient have a treatment resistant, you can give this medication. Patient who has a clozapine and they are resistant, you combine with that with this medication, and this medication is Amisulpride. Thank you for joining me today, and I would love to see you my next video. I will go over other medications and case study. Please prescribe and come back and see you again. Thank you.